As of 2025, 54% of people on Medicare have Part C Medicare Advantage plans, while 21% have Medicare Supplements. But what's the actual difference? Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare Maze. So in today's short video, I'm giving you guys a very simple comparison of Medicare Advantage versus Medicare Supplement. And I'm going to go over three real basic topics. So number one, I'm going to tell you guys what the prerequisite is to have either one of these plans. Number two, I'm going to do a side-by-side comparison of each. And then last, I'm going to tell you some pros and cons about each setup, and that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this information helpful. I really appreciate you doing that. Thanks. Okay, so what is the prerequisite to have a Medicare Advantage or a Medicare Supplement plan? Well, you can't have either one of these plans if you don't have Medicare A and B. So Medicare Part A comes with no monthly premium. As long as you paid into Social Security for 10 years or 40 quarters, you have no premium for Medicare Part A. And then Medicare Part B comes with a $185 monthly premium. So the prerequisite, whether you want an Advantage plan or a Medicare Supplement, you have to pay for the Medicare Part B premium, which is $185 a month. Now, the second prerequisite is if you're going to do a Medicare Advantage plan, you have to live in a service area where that plan is offered. Because Medicare Advantage plans are different in every county throughout the country. There's counties that don't have Medicare Advantage plans. There's other that have 80 options, and there's other that have 30 or 40. So if you're going to do Medicare Advantage, you're going to have to live in a service area where it's offered. Now, for Medicare Supplements, you have to be at least 65 to obtain a Medicare Supplement. So people are on Medicare prior to 65 if they have Social Security disability. However, no insurer will sell you a Medicare Supplement unless you're 65 or older. Okay, so let's dive into the meat and potatoes of what supplements and Advantage plans are really all about. So let's start with names, like what are they called? So when you hear Medicare Supplement, you'll also hear the term Medigap. So Medigap and Supplement are interchangeable. It is the same word when it comes to Medicare. And then there are different types of Medigap plans. So if you ever hear of a Plan G or a Plan N or a Plan F, those are all different types of Medigap plans. So in essence, whether you hear the word supplement, Medigap, G, or N, those are all talking about Medicare Supplement plans. Now, when it comes to Medicare Advantage, you'll hear different names for that as well. So Medicare Advantage is also known as Part C of Medicare. So you could call it a Medicare Advantage plan, or you could call it a Part C plan. Now, some people call these managed care plans. So if you hear the word managed care, they're definitely talking about the Part C side of the chart. And then I've also heard people call this Medicare replacement or a Medicare replacement plan. Now, I would never call it that, but there are people out there that do refer to this as Medicare replacement. Okay, so what about the monthly cost? Well, again, from prior in the video, you have to have Medicare Part B to have either option. So you're already going to be paying $185 a month, whether you have a Medigap plan or a Medicare Advantage plan. So when we talk about Medigap plans, you're paying $185 a month plus an additional premium. Now, depending on where you live, these premiums are going to vary drastically. So, the average for somebody turning 65 is anywhere from $100 to $200 a month, on top of the Part B Medicare premium. And when it comes to a Part C Medicare Advantage plan, usually Advantage plans have no extra monthly premium. However, there are Advantage plans that do come with small premiums. Okay, what about deductibles? So when you have a Medicare Supplement, you're going to have a $257 yearly deductible. That's it. Once you pay your $257 deductible, almost everything else is paid in full by your Medigap plan. And then on a Medicare Advantage plan, most Medicare Advantage plans don't have an annual deductible. But that doesn't mean you're not going to pay anything. We'll find out about what costs you have in the next section on Medicare Advantage. But the majority of Medicare Advantage plans, they have no annual deductible. Okay, what about copays? Like, do you have to pay a copay when you go to a doctor? So with Medigap plans, if you have a plan F or a plan G, there are no copays. Once you've paid your $257 deductible, everything else is paid at 100% by your Medigap insurer. Now on a plan N, which is a Medigap plan, you have a $20 copay to go to the doctor, and you have a $50 copay if you go to the ER. But these are the only copays on Medigap plans. You won't pay a copay to go to the hospital. You won't pay a copay for surgery. It's just the ones on the plan N that you're going to pay at the doctor and ER. Now on Medicare Advantage, remember there's no deductible. But instead of having a deductible, you're going to pay copays. So with all Medicare Advantage plans, there's going to be a copay attached with every service you do. Now sometimes that could be a zero copay. So Medicare Advantage plans often will give you primary care doctor visits, and they'll give you things like blood work for no copay. But almost every other service you do is going to come attached with a copay. So when you go to the hospital, your first 4, 5, 6, even 7 days will have a copay. Surgeries, copay. Cancer treatments, co-insurance. So the Medicare supplements, rarely you're going to pay a copay. Medicare Advantage plans, you are always going to have a copay associated with the service that you're doing. Okay, now what about dental and vision? Well, when you have a Medicare supplement, if you want dental and vision, you have to purchase that separately. You're never going to find dental and vision included in a Medigap plan. So if you want it, you have to pay an additional premium to pick up dental and vision coverage. Now on the Medicare Advantage side, most Medicare Advantage plans do offer some type of dental and vision benefit included right in their plan. Now, it's not 100% across the board, but most Advantage plans do give you a dental allowance and an allowance for glasses every year. Okay, what about your prescription drug coverage? Well, again, on a Medicare supplement, you have to purchase that separately. So you're starting to see on Medicare supplements, you're buying everything a la carte. You're buying your Medigap plan, you're buying your dental plan, your vision plan, and then you're also purchasing your Part D drug coverage. On the other side of the aisle, on Medicare Advantage, most Medicare Advantage plans include your drug benefit right in the plan. So you're getting everything under one roof. So you guys have probably seen extra benefits advertised on Facebook, Google, and really wherever you go on Medicare plans. And when you have a Medicare supplement, you are not going to get extra benefits. There won't be an over-the-counter card, a food benefit, transportation. None of those things are included in Medicare supplement plans. On the other side of the aisle, Medicare Advantage, that's where you get the extra benefits. Now, each plan is completely unique. One plan might offer $30 every quarter for over-the-counter. Another one might offer $150 every quarter for over-the-counter. But Medicare Advantage plans are known for having extra benefits. Things like gym memberships, OTC, food cards, transportation. Those types of things are found in your Part C Medicare Advantage plans. Now, most people want to know, well, do I have to stay in a network? That's the beautiful thing about Medicare supplements. There is no network. When you have a Medicare supplement, it doesn't matter who your insurer is. Your insurer could be Cigna, Aetna, United Healthcare, Blue Cross. It doesn't matter. You can go to any doctor that accepts Medicare. When you have a Medicare supplement, as long as the doctor accepts Medicare, he has to accept your Medicare supplement. And on the other side, on a Medicare Advantage plan, you are always going to be in a network. So you have to stay in the network of doctors and hospitals if you want to receive the lowest cost. Now, there are different types of networks on Medicare Advantage. There are HMOs, where you have to stay in network to be covered. And then there are PPOs, where you're able to go out of network, but if you do, you will pay more. But on any Medicare Advantage plan, you are going to have some type of network. Whether it's an HMO or PPO, you are certainly in a network of doctors and hospitals. What about prior authorizations? Do you have to get approval from an insurance company to get a service done? Well, under Medicare supplements, prior authorizations are very, very rare. And when they happen, they generally happen for things like durable medical equipment or a really specialized surgery. So with Medicare supplements, you are rarely going to have a prior authorization. You are rarely going to have to get an okay from the insurer to get a test or a surgery done. Where with Medicare Advantage plans, 99.9% of Medicare Advantage plans do require prior authorization. So your insurance company, your plan is going to have to approve certain services. And according to a study that was done by the Inspector General's office, 7% of prior authorizations are declined on Medicare Advantage plans. So that should give you a pretty good idea of the difference between Medicare Supplement and Medicare Advantage. And a lot of times you could think of these as just kind of working oppositely. With Medicare Supplement, you have monthly premiums. With Medicare Supplement, you don't have a network. Medicare Advantage, you do. Medicare Supplement, no prior authorization. Medicare Advantage, prior authorization. So most of the time, MedSup and MedAdvantage, they just kind of work oppositely of each other. So if you're considering what type of coverage to do on Medicare, you're going to want to know the pros and cons of each. So let's get into those now. So when it comes to Medicare supplements, the positives would be, well, you have incredibly predictable costs because you're paying a monthly premium and then you're not having to come out of pocket for other services. So very predictable costs. Number two, a pro is that you don't have a network. You never have to find out what doctor's covered and what doctor's not. As long as they take Medicare, they're going to be covered. Number three, you don't have to get prior authorizations. You never have to worry about an insurer denying a service because those things just aren't required when you have original Medicare with a supplement. Another positive of a supplement is the plan doesn't change every year. Your price can change, but your coverage doesn't. So when you go year to year, you don't have to refigure out how your plan works. The way your plan worked in 2025 is exactly the way it's going to work in 2026. Now, what are the positives on Medicare Advantage? Well, the first would be you have lower monthly premiums. You don't have to pay that extra premium that's associated with a Medigap plan. Secondly, a positive would be the extra benefits that the Part C Advantage companies offer. The gym benefits, over the counter, the food cards, hearing aids. These things can add up and really be a great value for people when you add up all the extra benefits that you're getting in your Part C Advantage plan. I think another important thing to note would be most Advantage plans will reward you for doing preventative services. So if you do a physical, you go to your primary care doctor, there's a lot of Advantage plans that will give you gift cards and rewards for trying to stay healthy and doing your preventative services. And then the last positive I could say on the Medicare Advantage plans is the drug coverage tends to be stronger than the drug coverage that's offered on standalone drug plans. So at least in 2025, this is true, that the drug coverage in Part C Advantage plans is really, really strong. Okay, so what are the drawbacks on these plans? So with Medicare Supplement, an obvious drawback is that you're going to have a higher monthly premium. Number two is that that premium can go up every year. So you might start by paying $100 a month, but by the time you're 80, that Medigap plan that was $100 a month is going to be well over $200 a month. I think another negative is that you have to buy everything a la carte. So you might end up with 4 different insurers. You might have an insurer for your Medigap plan, you might have a different insurer for your Part D drug coverage, and then you might have different insurers for your dental and vision. So when you buy everything a la carte, sometimes your coverage could be a little bit confusing. And then lastly, you're not going to get any of those extra benefits. Your plan is there strictly for medical coverage. Okay, what about Medicare Advantage? What are the real drawbacks here? Well, I would say a drawback is that you're paying copays all year until you've met your maximum out of pocket. Okay, number 2 would be that you do have to stay in network. So if you want to receive the lowest cost for all your services, you have to go to a network doctor, which depending on where you live, sometimes that's not a big deal. But what I find to be the biggest drawback is that doctors are allowed to leave networks mid-year. So just because you signed up for the plan and the doctor was in network does not necessarily guarantee that doctor is going to be in network the entire year. And then yes, you do have to receive prior authorization for services. Most of the time, these prior authorizations are approved, but 7% of the time, prior authorizations are declined. And in that scenario, then you would have to appeal, or else you would not be able to have that service paid for. And then lastly, the last drawback to a Medicare Advantage plan is it's only a 1-year contract. So whatever you have in 2025 is not going to look exactly the same in 2026. Your plan is ever changing, which means you have to stay up on the changes or you're going to be in the dark on how your plan works. So guys, to conclude, whether you have a Medicare Supplement or a Medicare Advantage plan, you have really good coverage. In fact, according to a survey that was done by Forbes in 2024, 93% of people that have Medicare Supplements and 96% of people that have Medicare Advantage plans said that the coverage met their expectations. So no matter which way you go, there's over a 90% chance you're going to be satisfied. And if you need help navigating these different options, well, that's what we're here for at LMS Insurance Group. So guys, I hope this video was helpful. I'll talk to you next time. Larry Goist, LMS Insurance Group. Thanks for watching.